100 people in this country have a genetic mutation that can be linked to their case of ALS. Researchers studied that gene and created a drug that works to counteract its impact. This is the first significant finding for the progressive and fatal disease.
And last week, Wink News health and medical reporter Amy Osher featured the journey of a local woman who had access to that drug. Well, today, she has more from the research team, which is working to expand the drug's use.
To say Amanda Sifford is 1 in a million would be an understatement. She represents a fraction of people in the U.S. with a genetically inherited form of ALS. With more than a dozen cases in her family, they were part of the study that led to the drug Casaldi.
We started off in what's called the pre-FAL study, pre-familial ALS, and that's when they were actually looking for the biomarkers so that they could develop the treatment.
The drug is a first of its kind for ALS. It targets the SOD1 gene. When mutated, it triggers a protein that kills nerve cells.
It makes it actually toxic.
Dr. Carberry is part of Sifford's care team at the University of Miami. He's now involved in a study testing family members of ALS patients to see if they have the gene, then using the drug if they do.
We're hoping that will either prevent ALS from occurring or it will dramatically improve their prognosis.
A study released in January found some patients on this drug, including Sifford, actually improved, giving hope for all ALS patients.
The learnings from this treatment, I think, will hopefully impact the sporadic ALS group, which is 85% of those that have ALS don't have a gene that we can point at.
One day, the key to a cure may be found in the genes. Amy Osher, Wink News.
University of Miami is enrolling people in the study to see if the drug works to prevent disease in those with the genetic mutation. It is also one of the largest sites in the country offering this treatment.